Hi friends, ഇന്ന് നമ്മൾ ചെയ്യുന്ന Nclex ക്വസ്റ്റ്യൻസ് ഹെൽത്ത് പ്രൊമോഷൻ ആൻഡ് മെയിൻ്റെനൻസ് നിന്നാണ്. അപ്പോൾ നമുക്ക് ചാപ്റ്റർ ക്വസ്റ്റ്യനിലേക്ക് പോകാം. ക്വസ്റ്റ്യൻ നമ്പർ 1. A 20-year-old client has just given birth. The baby looks healthy with the exception of giving a grimace instead of a cry. Which of the following would the nurse expect the obstetrician to say? So we rate the baby for Apgar score by 5 major categories. Like all the score starts from 0 to 2. If everything is 2, then the maximum score is 10. So it is out of 10. So it's based on heart rate, breathing, muscle tone, reflexes, and skin color. Okay, these are the 5 strategies monitoring. So if all score 2, that means the baby has got the maximum Apgar score, that is 10. So the Apgar score, so only one thing only mentioned here, that is grimace instead of cry. Cry scores 2, grimace score 1. So it's only one thing is mentioned here, so it has to be 1 less than the maximum score, so it has to be 9. Okay, the option I will read for you. The Apgar score is 3, Apgar score is 6, Apgar score is 9, the Apgar score is 12. So easily you can eliminate, because 3 is too low, 6 also too low, and the 9 is the possible one because 10 is maximum and there is no 12. Yeah, that's it. So second option is the outpatient. Second question, the outpatient client is post-menopausal. In discussing breast self-examination, which of the following should the nurse let the client know that she can do? So you post-menopausal lady, keep points in mind. She's an outpatient and post-menopausal, and breast, you are going to tell her about the breast self-examination. So she is not getting any menstruation, her regular menstruation is stopped because post-menopausal. So the option number 1 is switch to an annual schedule because she does not have periods. We never recommend for annual schedule like that. So this anyway the lady has to do her breast examination. Now you have to tell her discontinue. We'll never say discontinue self-examination because hormone changes decrease her risk. So eliminate that too. Wait until her mammogram shows some findings. So she don't have to wait for that. She can do what she can do herself. Self-examination she can do. So the last option is continue to palpate monthly, picking her own meaningful date. That is the correct one. So if she is doing on date 10, she has to do on date 10 because that is the meaningful date she choose and she can do on that. Okay. So the question number 3, next one. The client with acne has been using isotretinoin. She tells the nurse that she recently learned she is pregnant. She asks, will my pregnancy interfere with the medication's effectiveness? Which of the following is the appropriate response by the nurse? So she is early pregnant and she has acne and she was on treatment. So she is the you have to teach the client. So what the option number 1 is, the medication is contraindicated for pregnant woman. Yes, that is isotretinoin is dangerous drug to contraindicated for pregnancy, so she should not continue. So you will have to change the route of administration because you are pregnant. So whether it is regardless of the route of administration, it should not be taken. That's it. So patient should stop that because the risk is more than the benefit. Option number 3, there is no reason you can't continue taking it. No, there is a reason because it is contraindicated with the pregnancies. Okay. Option number 4, if the medication help you to better, then it look better, then it will help feel better about yourself. No, look is not important at this point. She should have a normal baby with normal growth and development. So it is a big no during this pregnancy to continue this medication. Okay, question number 4. The nurse is preparing for a women's health fair. The nurse knows that which of the following is correct when teaching about the risk and benefit of hormone replacement therapy. So we are talking about HRT. So she is in health fair. The option number one is HRT is related to a decreased risk of deep vein thrombosis. No. So, but what it does, it increases, okay, it deep vein DVT, it increases the risk of DVT. Then hormone replacement therapy is related to an increased risk of coronary artery disease. Yes, before earlier we were thinking there was theories saying that it decreases CAD. No, that is not correct. The reason what is that, research show that it is increases disease of coronary artery disease risk. Okay, so it is increases. Next is HRT is next option is HRT is related to an increased risk for osteoporosis related to bone fracture. Now in this case what it is, it decreases, okay, because hormone replacement therapy decreases the risk for osteoporosis. The fourth option is hormone replacement therapy is related to a decreased risk of breast cancer. No, it increases risk of breast cancer. So it increases risk for DVT, it increases the risk for breast cancer, and it increases risk for coronary artery disease, but it decreases the risk of osteoporosis. Okay. Now question number 5. The nurse has been working with a 45-year-old African American who bicycles to work. Lab tests show low serum lipids. The nurse knows that the client risk factor for primary, the essential hypertension, include which of the following? So being under the age of 65, what is that? That is a low risk. Below 65 is a low risk for essential hypertension. Race. African American is their race itself is a high risk for hypertension. Low serum lipids. That low serum lipids is a low risk, so that is not correct. Then activity lifestyle. If the patient, the person is active, so they come under low risk. So low serum lipid and activity lifestyle and being under 65, they are all low risk. What makes that person put into risk is the race. African American race is a high risk for hypertension. Question number 6. The nurse is designing a diet plan for a 70-year-old with a poorly fitting dentures who has been recently diagnosed with type 2 diabetes. The nurse knows that which of the following is the least likely risk to the client. So it's a negative stem question. We are asking about the least likely. Okay. So this person he is 70 years old and he has poorly fitting dentures. Dentures are poorly fitting. So you know that this poorly fitting can make that person difficult to eat, or like that people have liquids or pureed diet. So least likely what here is malnutrition. This person is at risk for malnutrition, sure. And this person, it is risk for dehydration. Okay, and this person is at risk for low blood sugar. The least one is what? Hyperglycemia. This person may not show the symptom of hyperglycemia because he is not eating much. So because loosely fitting and is type 2 diabetes, is not eating much. So least likely this person will be hyperglycemic. So more risk is for hypoglycemia. Okay, this person is more risk for hypoglycemia and dehydration and malnutrition, not hyperglycemia. Question number 7. The nurse is providing education at a senior center. Which of the following measures will the nurse say is most effective in attaining normal blood sugar level in a client with a type 2 diabetes? So most effective measures. Okay, so decreasing sodium intake. Do you think that sodium intake is going to do something? It's not applicable. Okay, increase is not. Next option is increasing potassium and calcium intake. Now it is not increasing potassium or calcium. It is not going to do anything with the blood sugar. Next is reaching recommended weight. That is because a 10 to 20 pound weight loss is really big. It brings the patient into good blood sugar control. Okay, so reaching a recommended weight loss is the correct answer here. Fourth option is decreasing daily exercise. No, what we recommend for a patient who is diabetic, we recommend increasing daily exercise. Okay, that helps for blood sugar control. So increasing daily exercise will good control for the weight control. These two things, and nothing. No sodium, potassium, or sodium or calcium intake is not going to help for the blood sugar. Next, question number 8. A local high school is having a health fair. Which of the following main courses should the nurse recommend as most helpful for a teenager whose cholesterol level is 300 milligram per deciliter? So his blood cholesterol is high and he's a teenager. So what the diet is: medium rare. So the option 1 is medium rare hamburger with only one slice of cheese. Option number 2 is vegetarian New York style pizza. Third is grilled chicken breast. Fourth is salad with extra dressing. So this all contains like the hamburger, the first option, hamburger or vegetarian with New York style pizza and salad with extra dressing. This all has high cholesterol. Okay, the high fat content in this. So only thing which is less in this option is grilled chicken breast has lower cholesterol level. So that is recommended for this teenager whose cholesterol level is 300 milligram per deciliter. Question number 9. The nurse is talking to a client who is still grieving the loss of parent to stomach cancer. The nurse knows that which of the following would increase the client's risk of cancer. So we are looking here the risk of cancer. What are the options? Okay, for child who the parents died due to cancer, stomach cancer. So you are looking for the risk factor for cancer here. Keeping a strict high protein diet. Option number 2, following a low fat, low carbohydrate diet. Question 3 option, using considerable spice when cooking. Fourth option is smoking cigarette. In all these options, smoking cigarette is putting the child for high risk for cancer. Rest like a high protein diet or low fat, low carbohydrate diet or spices in cooking is none of this showing a risk for cancer. So smoking cigarette is the high risk. Question number 10. A 3-month-old child accompanies her parent to a seasonal flu clinic. The baby is 3 months old only, okay? Assuming that the child does not have a fever, can the nurse give the child a flu shot? So baby is not suffering from fever, okay? So baby is in the clinic for a flu shot. Now look in the so yes, if regular immunization are up to date, she can give. No, because the child is not old enough. Third option is yes, because then the child won't get sick later. Fourth is no, because it would interfere with the regular immunization. So the main clue point here is the baby is 3 months old. Baby is the minimum age for receiving flu vaccine is 6 months old. This baby is underage, so nurse can't give. Okay, the option number 2 is correct. No, because the child is not old enough. Okay. Question number 11. The nurse gives a 35-year-old primigravida client a Roga. Roga means anti-D, okay, injection in her 28th week of pregnancy. Which of the following client situation require the nurse to take this action? First is Rh positive mother and Rh negative father. Rh positive mother and Rh positive father. Rh negative mother and Rh negative father. Rh negative mother and Rh positive father. So here, if the mother is Rh positive, you don't have to do anything and you don't have to worry about the Rh factor for the father. Okay, only the Rogam or anti-D is receiving the mother who is Rh negative and her baby who is Rh positive, or sorry, husband is Rh positive. In that case, you are giving anti-D or Rogam. Okay, so because there is a chance that the mother may expose to lots of antibodies in this pregnancy, we are giving Rogam or anti-D for the future pregnancy. We are giving for the future pregnancy, not for the current one what she is having. Okay, so that is for Rh negative. Always the mother is Rh negative and the father Rh positive. Okay, and once the baby is born, we do the blood grouping screening for that baby. Then the baby comes out positive. Like for example, O negative mom have an O positive baby, then she will receive Roga. Question number 12. The nurse is teaching a young male client to recognize the most common early sign of testicular cancer. The nurse emphasized the fact that he should be aware of which of the following. So this man, he is a young man and he has testicular cancer. Early sign. So you are telling him about the early sign of testicular cancer, not the later. Okay, early. So option 1 is lumbar pain. Option 2 is urinary frequency. Third is urinary urgency. Fourth is painless testicular enlargement. Out of all these options, painless testicular enlargement is the early sign. Okay, if the man says that lumbar pain, that is a stage of metastasis, is already reached in the stage metastasis stage. Okay, and this urinary frequency or urinary urgency is not early signs. So the painless testicular enlargement is the early sign of testicular cancer. Question number 13. New parents are concerned about an unexpected characteristic of their newborn baby. Which of the following would cause the nurse to initiate contact with the physician? So, let's see. The new parents, okay, keep some things in your mind, the keywords. New parent, they are concerned about some characteristic in their newborn. Okay, swollen genitals and breast. Some babies born with the genitals are swollen and sometimes the breast is swollen. That is considered as normal because of the maternal hormone. It happens because of the influence of the maternal hormone. Okay, it will go itself. Okay, high pitched crying. High pitched crying is not normal. This may be a sign that the baby is having some neurological problems. Misshapen head. Misshapen head is normally maybe caput. So this will go itself. It's a normal finding. Milia is some small white spots. Those things are normal. So you don't have to worry about milia or misshapen head or swollen genitalia and breast. What you have to worry or your concern need attention is high pitched crying because the baby might be having some neurological problem. 14. Question number 14. A public health nurse visits a client at home 3 days after the client gave birth. In which of the following situations should the nurse instruct the client to report to a clinician? So postpartum, she delivered and she got baby and this is the 3rd day. Okay, so some options there. So it is, first option is vaginal drainage with streaks of bright red blood cell, bright red blood. Then second option is some discomfort at the site of her episiotomy. Third is feeling of fatigue late in the afternoon and evening. Fourth option in elevated temperature without other symptoms. So in this is, it needs a concern, mainly needs attention here is vaginal drainage of streak of bright red blood is normal until 6 weeks. You can see that one. Some may early disappear, which is a rubra, alba, like that. There are different stages of this lochia. So that is considered as normal because it's a 3rd day. Still, there will be bleeding for her. And perineal episiotomy discomfort, that also will be there. That is also considered normal. And feeling of after delivery, of course, the mom will feel some feeling of fatigue late in the afternoon, evening, because her body is tired at this point and she needs some time to recover from that. And an increase of temperature like more than 38 degrees centigrade, 100, that required attention and that she should call the physician for that. Okay, Question number 15. The pediatric nurse is providing discharge instruction to the parents of a newborn. In which of the following situation would the nurse advise the parent to call a physician? So it's a pediatric nurse. Discharge instruction is given to parent of newborn. Okay, newborn, and what instruction she should give? Okay, the infant has a temperature of higher than 100.8 degree Fahrenheit or 38 degrees centigrade. The infant vomits more than once in 24 hours. The infant's respiration are even and unlabored. Fourth option, the infant is unable to keep down food or water. Option number 5, the infant has sunken or swollen soft spots on the head. So in this, if the parent notice the baby is having temperature like more than 38 and above, should inform the physician, should call. The infant vomits more than once. Okay, we can ignore if one vomit 24 hours, but more than once you should consult doctor. The infant's respiration are even and unlabored. That is a normal finding. Even and unlabored respiration in newborns, that is normal. You don't have to call the physician. The fourth option is infant is unable to keep down food or water. If the baby is vomiting all the time, so you should call the physician. Then the infant has sunken or swollen soft spot on the head. That also should be inform the physician, or you should consult doctor. For sunken or swollen soft spots on the head. So sunken means is a sign of dehydration, or there is some abnormality, maybe some bleeding or something, that is maybe a swollen soft spot you may notice. So you should call pediatrician for that too. So if more than temperature more than 100, vomiting more than once, and baby is not drinking or keeping food inside, and there is a soft spot, swollen soft spot, or infant sunken or soft spots on the head, should be informed to pediatrician. Okay. Question number 16. The client's first day of her last period was February 1st. Which of the following should the nurse tell the client is her expected date of delivery? So her last day of her menstrual period, first day of her last menstrual period is February 1st. What you have to do is you have to add 9 months plus 7 days from the date. February 1st, you have to add March, April, May, June, July, August, September, October, and November. So you added 9 months plus 7 days. So November 7 plus 7 days makes November 8. Okay. So her expected date of delivery is November 8. Next, question number 17. The client is 7 months pregnant with her first child. She is anxious because she feels some mild contractions at times. The nurse tells her which of the following. So the mild contractions is a tightening the moms will feel, that is considered as normal throughout the pregnancy. They are called Braxton Hicks. Okay. So let's see the options. She should increase her bed rest to prevent those contractions. Option number 2, the contractions are normal unless they increase in severity. Option number 3, the contractions are a way of her body asking for more exercise. Fourth option is she should avoid getting constipated and having gas as a result. The correct option here is the contractions are normal unless they increase in severity. Okay, if they are not going away, frequently they are coming, it's more painful, that she has to focus more on that, and she should report to the doctor or come to hospital, because this is more than a normal Braxton Hicks. Okay. 18. Question number 18. The client is 40-year-old and pregnant with her first child. Keep in mind the keyword 40 years old. Okay, they are at high risk. Her obstetrician has asked the nurse to schedule her for an amniocentesis. The client inquires why she needs that test. The nurse says as which of the following is an explanation. So 40 years, above 35, the high risk. Okay, amniocentesis is an it's a procedure, it's an invasive procedure. Under the ultrasound guidance, they will locate the pool of amniotic fluid. From there a small amount is taken out and the test is done. That's called amniocentesis. Okay, so let's see the option. We routinely do an amniocentesis on all our clients to check the child's gender. No, that is not the purpose, or not for all. Who is at risk only we do. Okay, so you can eliminate that. An amniocentesis is not invasive, so there is less risk than doing an ultrasound. So no, amniocentesis is an invasive procedure, so you can eliminate that too from that sentence. Okay, the next third is the standard for doing an amniocentesis is motherhood over age 35. That's the correct option. Then if we know the baby size, you can better count on having a vaginal birth. This is nothing, it's not matching at all. Okay, so the option is standard for doing an amniocentesis is motherhood over age of 35. That is the risk. So amniocentesis is done who is 35 and above. Okay, a pregnant woman who is 35 and above. Question number 19. The nurse is educating a mother to be about possible danger signs during the last 3 months of pregnancy. Which of the following would not cause the nurse concerned about danger signs? Would not cause, it's a negative stem question. So one, you are taking the correct, the answer here correct will be which is not applicable for that. So all rest will be correct with that state, with that condition, but one will be wrong. So let's see. Rectal bleeding, that's first option. Second is continuous headache. Third option is marked swelling of head. Fourth option is blurred vision. So all these three goes with this. Right, rectal bleeding. Rectal bleeding is because for danger of sign during the last 3 months of pregnancy. Rectal bleeding, maybe she has hemorrhoids. Okay, so you don't have to worry about that. She might be having the hemorrhoids and maybe having some bleeding, but if it is severe bleeding, of course. But in this, since she is pregnant last 3 months, we have to focus more. Priority is focusing on more things like continuous headache. If she has continuous headache, you have to focus. Then marked swelling of the hands or blurred vision. These are all the signs of preeclampsia or pregnancy induced hypertension. These people have, they are at risk. So these things you have to focus. Okay, so the rectal bleeding is the least, not to cause the nurse to concern about danger signs. Okay, so that is a negative stem question. So rectal bleeding you can choose. So rest all are preeclamptic or eclamptic or preeclamptic patient sign or pregnancy induced hypertension signs. Question number 20. A first-time parent is discussing developmental milestones with the nurse. The nurse tells the client that she can reasonably expect her child to achieve which of the following by the time is 1 year old. So you are looking into a baby who is 1 year old, what all activities the baby can do. Okay, walking means some babies walk, but you know, in generally when you see, you have a time frame for up to 1.5 years, so you can eliminate that one. So you are not expecting a 1 year old baby, all 1 year old baby will walk, no. So you can wait until 18 months, so that you can remove. So next one, rolling from tummy to tummy. Yes, 1 year old baby easily they can roll from tummy to tummy, they can roll. Okay, transferring toys from one hand to another. Yes, that easily a 1 year old can do. Beginning to respond selectively to words. Of course, when you start talking to baby begin to respond. Then vocalizing sounds like coo sound babies make. So these are all the 4 options out of 5. They are all correct. Rolling tummy to side, from tummy to side, transferring toys from hand to hand, beginning to respond selectively to words, vocalizing sounds. These are all correct options. You can expect all those activities by a 1 year old, but walking is not. You can remove that. Okay, then question number 21. A parent is discussing the behavior of her 3-year-old child with the nurse. At 3 years, the nurse would expect the client's child to be doing all of the following except which activity? So you are looking all the activity except it's a negative stem question. So one thing, that 3-year-old is not doing one thing out of all these options. She's not, one option is wrong. Okay, rest all will be correct. So now saying no often, oh yes, they 3 years old, they mostly they say no, 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 everything is no for them. And second is using a limited vocabulary of 500 to 3000 words. Yes, they may speak that 500 to 3000 words. Speaking in 10 word sentence, that is too much for a 3-year-old baby. The baby may speak 3 to 4 word sentences. Okay, so believing that the adults know everything, that also the babies think that adult know everything. That is fourth option. So here what the you don't see the speaking in 10 word sentences by a 3-year-old. Okay, that is the excepts, and means that is a negative stem question. You can eliminate, you can choose that one. Question number 22. The nurse is teaching a group of mothers of toddlers how to prevent accidental poisoning from medications. The nurse teaches the mothers to store medications in which of the following locations? So, you are teaching a parent, a mother of toddler. Okay. So, first option is where to keep medicine safely. First option is in a secure locked place. It's a correct one. Okay. Option number 2, in vials with the child proof caps. Babies can even, they can open that too they can take off caps. Okay, on the highest shelf of the room, babies climb, they pull chairs, steps, then they can climb, okay, and reach. Okay, that's not safe. Used in different containers. If you hide in different containers, there is a chance for medication error, so don't do that. So in a secure locked place is the correct way of storing medication of if the parents have toddlers at home, they are curious, they will open everything, they want to see, and so you should keep in a secure locked place. Question number 23. The nurse is assessing an elderly couple, both 80-year-old, to determine if they can safely continue to live and independently. They insist they are getting along fine but need help with grocery shopping and housekeeping. The nurse determines that they have difficulty in doing which of the following. So the 80-year-old both, okay, so they are able to do their activities of daily living ADLs by like feeding, dressing, bathing. They can do everything. What they can do is grocery shopping and housekeeping they can't do. So what they are instrumental activities of daily living, that is IADLS. Okay, so they can't do that one. Rest ADLs they can do. First option, that is correct, they can do. So the what is here apply for this grocery store shopping and housekeeping is instrumental activities of daily living. Okay, so your correct option is here IADLs. Daily living milestones, that is daily living milestones or preventive health activities is grocery shopping or housekeeping is not included in this. Okay, now question number 24. The nurse is giving a lecture at the senior center about preventive health activities for people over age 60. The nurse tells the client that the Centers for Disease Control and Prevention now recommends which of the following vaccine for this age group. So age group over 60. Okay, so over 60, the CDC, what is the Center for Disease Control and Prevention, what is the recommendation for the people who is over 60? So that is our option we are looking for. So the first option is shingles, second is diphtheria, third is pertussis, fourth is meningitis. Shingles is the correct answer because if you give shingles vaccination, that will reduce half the risk for the elderly like 60 years of getting shingles, and 2/3 of post herpes post shingles herpes zoster, that infection, neuralgia also decreased by 2/3. Then if diphtheria is given in early age, pertussis, that whooping cough, that one also given in early age. But meningitis vaccine is given to the freshmen in dormitories like high school or college or universities, who is going or who is in first, if it's a new fresh start for job, those people are receiving meningitis. Okay, freshmen in dormitories, they are the main category receive meningitis vaccination. Question number 25. The nurse is teaching about the challenges of smoking cessation. Which of the following factor will the nurse identify as non-challenge that the clients face when attempting to quit smoking? Select all that apply. It's a SATA question. So the problem is here is smoking. So want to stop smoking. Okay. So what are the challenges for this guy in comes in front? So if you want to stop, he'll be stressed and depressed, sure. The second option is low level of income, of course. Usually the low level of income people are more smokers. Okay, they are more what is that prevalence among the low income people. So low level of income also. And the third one is high level of education. Do you think high smokers will have high level of no? So you can remove that option. Low level of education, no. No, they'll have low level of education, not high level of education. Psychosocial problem, of course these people will face psychosocial problem. Then they will have continued exposure to smoking associated stimuli. Of course these people will be when they exposed to smoking associated stimuli, they are more, that's a challenge for them, they can't control, they may start again. So these options are the correct options: stress and depression, low level of income, psychosocial problems, and continued exposure to smoking associated with stimuli. These are the challenges you may see people who want to quit from smoking. Okay. 26. Stress reduction technique include biofeedback and meditation. The nurse conducting classes on these methods knows that studies have shown a cause and effect relationship between stress and which of the following. Select all that apply. This one also a SATA question. So the first option is adverse medication effect. Second is infectious disease. Third is traumatic injuries such as motor vehicle accidents. Fourth is some chronic illnesses. So adverse medication effect doesn't have any association to stress. Okay, keep that in mind. But infectious disease can be a cause for stress. Okay, they have a relation. And a traumatic injury, that also have as association with, there is a relationship with possible can cause stress. And some chronic illness people can be stress. Okay, so these all three options like infectious disease, traumatic injuries, motor vehicle accidents, and some chronic illnesses, they all can be a cause for stress. So you can eliminate one, that is adverse medication effect is doesn't have an direct association with the stress. Okay. Question number 27. The nurse is performing the initial assessment of an adult from a culture the nurse is not familiar with and ask about the client's use of alternative therapies. The client says irritably, do you have to ask all these questions? Which of the following is the best explanation for what the nurse should do in response? So the patient is angry. So he is asking, do you have to ask all these questions? So how the nurse has to respond at this point? Ask the question because the nurse might learn about therapies used by a different culture. That is not an important thing here. So nurse learning is not the priority here. So you can easily eliminate that one. Of course she will know different when during her work and when she interact with the patient, but that is not the priority here. Ask the questions because the knowledge about actual use of other therapies is imperative, because that is important, because any medication is any treatment the patient is going to receive may interfere with the medication what the patient is already taking. So so it is important to know what other medication, the other therapies the patient is on. So So option number 3, don't ask a question because it is important to not upset the irritable client any further. No, we have to see the safety of the patient, and we should give a correct medication, and we should get maximum information the patient we could get from the patient. Option number 4, don't ask the question because the client needs to choose to initiate a discussion of other therapies. So the patient is so angry he will initiate something, it's a remote chance. So so that's not the correct option. So she should ask questions because the knowledge about the actual use of other therapies is important for along with this current treatment what the hospital is going to start for the patient. Question number 28, the client is preparing a community educational presentation. The topic is the leading cause of death for people from ages 1 to 44. The nurse knows that which of the following is the leading cause. There are 4 conditions are given. Death among 1 year to 44. Okay, cancer, heart disease, unintentional injuries, and diabetes. Okay, so all this, out of all these options, unintentional injuries are the main reason for death. Main reason for the people age among 1 to 44. Rest, cancer, heart disease, and diabetes are not the cause of death among 1 to 44 years of age. So unintentional injury is the correct answer. Question number 29, nurse is reviewing the client's lipid profile to determine if education is needed to reduce the risk for heart disease. Nurse knows that how to match the healthy target values with a lab description. Match appropriate part of the profile below on the left to the value on the right. All options must be used. So we have 5 options and 5 answers. All should match and should correctly. So total cholesterol has been less than 200. I'm just reading the answer. Okay, it has to be less than 200 total cholesterol. So you choose the high number, that is 200 here. HDL cholesterol for men. Okay, HDL is cholesterol for men is more than 40. HDL cholesterol for women is more than 50. So it has to be, men needs less than woman. Okay, so go with that in that way. So just some clue I'm telling. HDL cholesterol for woman, I said. LDL cholesterol is, it has to be less than 100. LDL less than 100. Okay, triglyceride less than 150. Triglyceride less than 150. LDL less than 100. Total cholesterol less than 200. HDL for men more than 40. HDL cholesterol for woman is more than 50. Okay. Then next question number 30, the nurse is assessing the best approach to prepare 3 clients for surgery. Each has a different learning preferences. Match the following preference to the appropriate approach. All options must be used. So brochure about preparation activities. Second option is models of the relevant anatomy. Fourth is discussion about the surgery. So discussion about the surgery, easily you can choose. So you are discussing, so he has to hear well. So auditory. Okay. Next is visual and tactile. So question number 30, in this brochure about the preparing activities are visual. The client need to see words and pictures. Brochure, that is visual. Okay. Then question model of relevant anatomy are tactile. If you show a person like anatomy of a heart, anatomy of lungs, something, and explaining what is that, that is a tactile, okay, way of learning. And the discussing about the surgery or auditory, the client needs to hear the words. So when you discuss about the post surgery or whatever it is, pre-surgery information, when you discuss, he has to hear it. That is an auditory way of learning. By seeing the anatomy, that one is a tactile learning method. And the activities, brochure about prepare activities for visual, the client needs to see words and pictures. Seeing the words and pictures, that is brochure. That one is visual. Okay, I hope this what in Nclex question discussion session went well, and it used to be means it will be useful for you. Thank you so much.